And then after your postdoc, you were an adjunct professor at Southern Connecticut State University, and you're currently an associate research scientist at Yale School of Public Health. So tell us about the transition, maybe out of your postdoc into these positions.
Yeah, so the adjunct professor is like what I just touched on about the teaching part because I love teaching. I wanted experience being like the primary like instructor of record versus I was a teaching assistant all throughout grad school. So I wanted to be like the actual professor or the teacher, if that makes sense. And so I was able to find an adjunct position at our local state university. And that's been so much fun to teach. I teach statistics, which I love. And that's just something I do like in the evenings. I teach statistics at Southern. And then, yeah, so the transition from postdoc to ARS was more of that, like, kind of, I don't necessarily want to apply for a tenure track position at this point. This was last year that I made this decision because that was my last year of postdoc. So in my last year of postdoc, I was at a place where I needed to decide what my next step was. And I wasn't ready to apply for a tenure track position, but I also wasn't necessarily ready to like leave academia. It was really just like a indecisive moment where I was like, I don't want to commit to industry right now, but I don't want to commit to a tenure track position. So the ARS was like the perfect in between for me. It was kind of like I can stay in the lab that I'm currently in. I can keep doing the work that I'm doing, but I can make more money than a postdoc, right? Because I could have probably, well, I never considered it, but like it probably would have been an option to extend postdoc for another year, but that's not very financially, like postdocs don't make very much money. So it was just like a perfect in between. It actually was like the ARS or the research faculty position is kind of like ticks all my boxes because there's no grant writing involved. Well, not that there's no grant writing involved, but I don't have to write grants to sustain myself. But I do contribute to grant writing in our lab, which I'm very happy to do. I can lead all the quantitative analyses. It's just like I can contribute and collaborate with people. But now that I've been in this role and I'm going to be in this role for the next year, I think I am deciding that industry is probably the place that I want to be next. And so it's just been a lot of growth and a lot of learning for me along the way.
And walk us through that. Walk us through that change in perspective. And I feel like you kind of alluded to some of the things along the journey that made you make that pivot, but give us everything.
Well, I mean, like, I think one, if I can find a position, a hard money position in an academic role that it aligns with the things that I like to do and pays me the salary that I want, then I would take it. So it's like if I do find that, then I would be happy to take that. But I'm really just happy working kind of like a traditional job. Like that's what I've discovered with this ARS position is that I do quantitative analyses every day. I do, general research related activities, and you can find those positions in industry and you get paid a lot more, to be frank. Like, unfortunately, academia doesn't pay a lot unless you're like the PI. And so I just realized that a lot of the things that I'm doing now, I can do in an industry role and get paid more. And I also have been learning a lot about what is out there in industry. And I've been learning that through talking with some of my supervisors and some of my mentors, as well as talking to people that I know that do this work. And I've just learned a lot more about what's out there and what options there are. There's a lot of cool work in kind of the government adjacent world. So, for example, there's the government does a lot of research, but they contract out private companies to do a lot of the research for them. And so that's a really big space that public health people can go into that I did not know about when I was in grad school. Like I was aware of it, but I didn't realize how much was out there and how much of it is related to what we do every single day. There's obviously like nonprofits, there's just a lot out there for people in the public health world that I've been learning about slowly, and I've realized that it's just very appealing to me. It's something that I love doing just as much as like it's still research, I guess is what I'm saying. Like it's still all research related, and that's really what I enjoy at the end of the day is the research. It's the quantitative methods, it's the program evaluation, like all of those things exist outside of an academic space, and that's where I'm kind of opening my eyes. So like seeing what's out there and realizing that the pay is just a little bit better than it is in academia.
No, that's a reality and I appreciate you sharing that. And like as you say in academia, I'm thinking just broadly like local governmental public health because I think the skill set that someone with a public health degree, especially Masters of Public Health and above, it could be so useful to so many different industries, to so many different companies. And I think about like your skill set specifically could be used in so many different places and I think maybe in public health haven't had the vision for those positions or haven't understood where we can fit into those different industries. But as we continue, I think, to learn and develop in public health, we are seeing that there are so many ways to make an impact with the skill set that you have, whether you're in local government, academia, or in a private industry job.
Yeah, exactly. I think that's what I've learned is that our skills are so transferable in public health. Um, and I think that that's not something that they necessarily tell us explicitly when we're in grad school. Not to anyone's like it's not necessarily anyone's fault, but I do think that that's something that should be kind of taught more is that these skills can really be transferred outside of traditional public health areas.
Yeah, absolutely. And that this is something that I want to dig more into because I think MPH programs originally started for like governmental public health specifically. So I can see why that kind of train of thought is there as well as like the academia piece just naturally being there. But especially in the last 4 years or so, we've seen so many like public health just come to the forefront, and as well as people seeing the value for the public health skill set. And I think I'm gonna write a post about this at some point in time, but I feel bad to say this, but it's gonna be very hard for governmental public health to catch up with what industry can afford
Right,
for people
right,
when they see the value and the skill set that we do have. So it's gonna
right.
be a ongoing battle for I think local public health, academia as well potentially. But that's a larger conversation for sure.
Yeah, definitely.